2008 October during Cancer Awareness Month. Sasa nilikuwa naona tu kwa TV hizo vitu. Nikalala tu kwa kitanda nikajifinya tu matiti. Nikasikia kalamp. Sasa this first one of mine, he is mommy's guy kabisa. Sasa nilimpeleka afanyiwe circumcision. Sasa nikauliza daktari, what's about this thing? I'm feeling something in my breast. Then the doctor told me that he come with 2,500, uende theater, utolewe uangaliliwe ni nini. Nikasema sasa why should I part with 2,500 hii kitu aniumi? Na mtu pia kusikia tunaenda kukatwa ilikuwa ni kama naenda kukufa operation. Sasa nilisema hainiumi, alafu 2,500 na kazi yangu na pesa yenye napata, nikaona hapana, sijaplania hiyo. Let me just wait, it's not paining. Kenye nilifanya niende sasa hospitali, nilisikia inaniwasha, ni kama naota moto, sasa inaniban. Nikasikia tu hiyo joto kidogo hapo tu. Nikasema hapana, si huyo mtoto ako shule. Akishaenda shule, mimi nikapanda gari nikaenda Lang'ata. Nilijipeleka tu.
So once you notice there's some change in your breast, then you seek for medical advice. The doctor will examine you, will check the shape, the size, will check any skin changes. They look at your nipple. Is there any roughness on the nipple? Is the nipple retracting backwards? They'll palpate to feel for any lumps. Once they check and maybe there are lumps, then they'll send you for further testing, which include drawing some specimen from that lump to check by a needle. They can also do a biopsy where they take a bigger specimen of tissue. You can also be subjected to a mammogram or an ultrasound, depending on your age and what the doctor suspects.
They told me to come for the result after 2 weeks. When nilikuja, daktari mwenye alinibreakia the news, aliniumiza kabisa. He was a young guy. Sasa sijui kama alikuwa intern ama nini. Aliniita tu kwa room, turn yangu ikifika. Akauliza ati, Fiona, you know what? You have cancer. And this is what we are going to do. We are going to chop off your breast. You're going for chemotherapy, sijui nini. Ikipatikana kwa makwapa, utaenda Kenyatta, utolewe nini. Nikasema, no, this is not me. You maybe not my results.
Most of the time, the causes of breast cancer in many people, it's not known. It can be random, but we are aware of some risk factors. One of them include the fact that you have a breast, whether you are a man, so long as you have a breast, you are at risk. The other risk factor include having few children, also having your first baby when you are over 30 years old. Also, if you have a strong family history of breast cancer, like in the first degree relatives, these ones we are talking about, maybe your sister or your aunt who had breast cancer, you are at risk. So it can be genetic, it can run in families. So it's something you cannot do about it. Then the other risk factor include as we age, once you hit 40 and above, the risk keeps increasing. And then the other risk factor is using hormonal replacement therapy, like for postmenopausal women when they get hot flashes and we use hormonal replacement therapy, they are at risk. And then the other simple things like lack of breastfeeding of children puts you at risk, and having no children at all also puts you at risk of breast cancer. Lack of exercise, using heavy use of alcohol and tobacco.
The earlier the best. You have to accept it, be positive, haitaki stress. You be positive and ukubali tu ukatwe.
For early stage, ideally you need to go for operation. Once the surgery is done, then the specimen from that breast tissue, and they also take lymph nodes from the armpit, they go and test. Depending now on the pathological stage, then you'll be subjected to more treatment, which includes chemotherapy and radiotherapy, but it all depends. Sometimes you can just have surgery and that is it. And also it is the specimen is taken for what we call hormonal testing, and if the hormonal receptors are positive, you can be given hormonal treatment for a couple of years, usually about 5 years. If it is advanced stage, for example, it has already spread to other organs, then you know probably you will have to start off with chemotherapy to shrink the tumor, and then the other treatments like surgery and radiotherapy can follow.